The American Diabetes Association tells diabetics carbohydrates can raise blood sugars, and that can increase the risk of heart attacks. And eating wisely can lower blood sugars. But as a type 2 diabetic, Richard Barado says that isn't easy.
I used to eat honey buns, I used to eat ice cream, I used to eat candy bars. I used to eat a lot of stuff you shouldn't eat.
Even with diabetes medication, Barado says his blood sugar was too high. So he enrolled in a nationwide study called ACCORD. Dr. James Felicetta led the study at one site, the Veterans Administration Medical Center in Phoenix. To lower blood sugars, he says some diabetics got extra medicine.
We pretty much had to throw everything we had, including the kitchen sink almost, at these patients.
But in the group which got more blood sugar-lowering drugs, more people died.
It shook me because, like I say, my father died at 50 years old. My brother died at 49, and I'm 60, and I want to live longer. I'm not ready to go.
Barado now takes only the standard dose of the medicine, and he skips the honey buns. While Barado says his blood sugars are lower, they're not normal. Dr. Felicetta says they may be good enough.
If you have older type 2 patients with high risk of cardiovascular disease, you can overdo the treatment.
But Duke University researcher Dr. Eric Westman says he worries that the U.S. is giving up on healthy blood sugar levels.
Glucose control needs to be tight. In fact, it needs to be normal in type 2 diabetics.
Because the study suggests high doses of medicine can be dangerous, Dr. Westman wants more studies to look at diet.
Put them on the right diet that controls the diabetes. You can actually achieve normal blood sugars without medication.
Dr. Mary Vernon, a diabetes clinician and author of the Atkins Diabetes Revolution, contends that the American Diabetes Association, or ADA, recommends too many carbohydrates.
American Diabetes Association says that 50% of your caloric requirement should come as carbohydrates, perhaps even higher, 50 to 60%. So if you're eating 2,000 calories a day, you do the math, that's a lot of carbohydrate. No wonder people need more and more medicine to control their blood sugar.
In their clinics, Drs. Westman and Vernon recommend only 10% of calories as carbs, plus leafy vegetables and lots of fat, a regime that is controversial among some doctors. They say on this diet, diabetics can often stop taking blood glucose-lowering drugs. Whether patients try for 10% or 50% of their daily intake as carbohydrates, the ACCORD researcher, Dr. Felicetta, says most diabetics won't stay on the diet.
I always say that a doctor who relies on exercise and diet to treat diabetes is going to have a very large collection of uncontrolled patients.
On a low-carb diet, Dr. Vernon insists her patients do stick with it. She wants the ADA to recommend her diet. At its annual meeting in June, the association will discuss the ACCORD study and related research, but at this time, the ADA has not changed its recommendations on blood sugar level or diet. For VOA, I'm Shelley Schlender in Phoenix.